Back to our Sweet Justice videos. This is going to be a little bit shorter of a video than our D-tip rotators, and that's because the printout is so much smaller and we don't really have that many muscles to cover. So I have my printout with me and I have my book with me, and this just seemed to work for the D-tip rotators. Hopefully this works for us right now. Let's start here. We have the Gluteus Minimus. So I'm going to use blue for this. Gluteus Minimus. Now, the origin of the Gluteus Minimus is between the anterior and inferior gluteal lines. So on the glutes, or on the hip rather, on the posterior side of the hip, we have what are called lines. They're rough to see. They're pretty difficult to see. On an actual skeleton, you could probably feel the ridges. But you have a posterior glute line, anterior glute line, and an inferior glute line. Kind of random. You would think that we would try to use like anterior, posterior, but we have those already. So we have inferior glute line. It's just because it's inferior. There's no superior glute line. Okay, that was confusing. Forget I even said anything about it. Here you can already see deep hip rotators. They're outlined here. And you can see already there's some other glute muscles that are attached on this side. But right now the gluteus minimus, it originates between the anterior and the inferior glute line. It's kind of difficult on our printout to make a note of that. If you had a printout, maybe I'll try to find one of like a blank hip. That might be good to find and mark those lines. On this picture specifically, I don't know that it even shows the gluteus minimus, because it looks like what we have here is the gluteus medius kind of covering the minimus. So what to do about that? Shall we figure it out? Let's just say it's not shown, but it's deep to medius. Let's write that down. Deep to medius, which means it's just underneath here. And if you want to, maybe you could even do like some dotted lines to say this is where it's going to attach. Is on the origin, it's going to attach in between the anterior and inferior glute lines, and then it inserts into the anterior surface of the greater trochanter. So comes out here and attaches to your greater trochanter, which we know is on the femur. So function, medial rotation, slight abduction, and it stabilizes the hip. It's the deepest gluteal muscle. Good to know. Next color I'm going to use is for your gluteus medius, and let's jump over here. Maybe I will use orange like I have already. Gluteus medius. So let's learn about the medius. It originates between the anterior and the posterior glute lines. So you can see here it attaches to this section of your hip. And this muscle is actually quite visible superficially. You'd have to take someone's skin off. I'm not saying do that, but your glute maximus actually only covers about half of this muscle. Well, my notes say 80% of this muscle is superficial. I don't know if I believe that. In most people, maybe it is. But you can see how big this glute max is. This big gluteus maximus you can kind of see how the medius will stick out there. But that maximus is all the way through here, big chunky muscle. So this is the medius muscle. It is just deep to the maximus. It originates anterior, posterior glute lines, and it inserts into the greater trochanter, which we know, I should point it out on this picture here, and then jump over to this picture. We have origination, the anterior and posterior glute lines between there, and then it inserts onto that greater trochanter. So I'll draw some colors into the muscle tissue there. Glute medius, and its function is to abduct the hip. So we have abduction of the hip. Okay. Next muscle in the glutes is your gluteus max. I'm going to use an easier marker for this one because it's such a big juicy muscle. I actually have a yellow marker already, so maybe we'll do that. It has two origins, specifically the iliac crest and the lateral edge of the sacrum and coccyx. You can see here. It originates here along the iliac crest and then coming down to the sacrum. That's where this muscle is going to originate. And it will insert into the gluteal tuberosity, which is on the femur. You can see here, there's the femur bone running down. There's a tuberosity right through here. We call the gluteal tuberosity. You can find it on your printouts. But then the second is that most of this muscle actually feeds into the iliotibial band. So when people say they have a tight IT band, maybe the glute max is a good muscle to work. Can it be a little bit strange because the origin is here? Yeah, you get a little bit close to that, gosh, what do they call it in anatomical terms? Anyway, you get close to sensitive areas. Maybe it's, not the best idea unless your client is super comfortable with you getting all those attachments, but really powerful muscle, and it has a lot of problem areas. So its function is lateral rotation of the hip and abduction. I'm going to pull out my printout so we can color it here. Pretty easy to see. Gluteus maximus. We don't want to color medius. We can see medius is up above. But we do want to color the origin here on the iliac crest, down the sacrum to the coccyx. Round that there. Inserts on the gluteal tuberosity and into the IT band. And there we are. That is your glute muscles. We have one more muscle that is technically classified as a glute muscle. So I'm going to use green for that because you know what? Green is awesome. Tensor fascia latte. I say latte. It's easier for me to remember. I'm not sure how you pronounce that exactly. But oh, I already picked green. How about that? Whoa, the camera's going crazy. Sorry about that, guys. Tensor fascia latte. It originates lateral to the ASIS. So let's actually point this out. Anteriorly, you could probably see this better. So this is the anterior side. Anterior. And it attaches here to the ASIS, or lateral to it. ASIS is short for anterior superior iliac spine. So iliac crest is here, iliac spine is here. I say spine because it makes me remember things a little bit more with an accent. The iliac spine. The name's Bond, James Bond. I don't know. Maybe something like that. Okay. Just lateral to the anterior superior iliac spine. People shorten this muscle as TFL because it's tensor fascia latte. I remember this as my latte muscle. I reach into my pockets to grab my latte money, right? And this is where their pockets are going to be. It's going to be kind of a juicy muscle, has a lot to do, but it inserts into the IT band. So function, flexion of the hip, medial rotation, blends in with the IT band. Let's see here where it would be. Perfect. Let's find that origin. We know where that origin is. It's just lateral to the ASIS and inserts into the IT band. So yeah, there we are. That is your tensor fascia latte. That is your glutes. I'm going to pause it right here, and then we're going to jump into the hip flexors, and I'll see you in the next video.